Hello. So we're going to be talking about patient scheduling. And I want to apologize now for the glare on my glasses. I'm sorry I can't do any better. And if I take my glasses off, I can't see. One of the things that I want you to keep in mind about patient scheduling is simply that every office has a different policy. So when you are actually employed or you get a job at a specific facility, they are actually going to train you in their particular policies. All right. So we're going to go through patient scheduling and some legal aspects and some different kinds of scheduling. We're going to talk about paper schedules, signing in, different things like that. All right. So here we go. I'm going to share our screen so we can get our Google Slides on board. All right, guidelines for establishing an appointment schedule and creating an appointment matrix. Patients need to feel their doctors spend enough time with them. So how many times have you gone into the doctor's office and you get brought back to the room, the doctor comes in, he spends 2 minutes and he's out, and you think, did I really see the doctor? We need to make sure that the patients feel special and that they have enough time with the providers. Scheduling person needs to learn each provider's habits and preferences in order to schedule appointments so that the provider stays on schedule. That again is something that there's going to be a policy in place for. There's going to be structures for you to follow and for you to pay attention to specific things that are working and not working so that you can make adjustments. So effective scheduling allows providers to spend adequate time with patients. Here are some factors for scheduling. You have to consider the patient's needs, and you also have to consider the provider's preferences and habits. You need to consider patient demographics when determining office hours. An appointment time scheduler must allot visit times based on patients' needs for each individual visit. That's going to be a lot of established patients versus new patients and knowing how sick patients are that are coming in. You need a balance between meeting patients' needs and the provider's preferences and available facilities. These are some factors that you need to consider. Provider preference for packed waiting room, provider worry over patient wait time, provider's promptness, provider's ability to transition from patient to patient, provider break times, and preference for quantity of patients or time with patients. Creating the appointment matrix. The first block out times when the provider will be available to see patients. You have to stop and think about if your provider goes to the hospital to see patients, when does he do that? Does he do that in the morning? Does he do that after lunch, or does he do that in the afternoons? In a paper-based system, the matrix is usually established for 6 months at a time. In a computerized system, the matrix can be set up indefinitely. Most facilities now are using a computerized system. When scheduling, make sure to allow enough time to complete a procedure. For example, never schedule a pap smear or minor surgery in a 10 or 15-minute time slot. It's just not enough time. The shortest office visit type should be a follow-up or recheck appointment. And some providers need prompting to end the patient visit and move on. Medical assistants can help with that. But again, that's not an administrative medical assistant. That's more of a medical assistant, which is what the other Miss Marcia teaches in school. Medical assistants should know how to pair patient needs with available facilities when you're scheduling. As the medical assistant gains proficiency in scheduling, it becomes easier to match patients' needs with available facilities. Advantages of computerized appointment scheduling. There is practice management software that ranges from simple to more sophisticated ones that can select the best appointment time based on information entered. Also, it helps keep track of future appointments. You can have printouts of schedules to help staff and providers stay on schedule. And more than one person can access the schedule so everyone is informed. Okay, so with a computerized system, you can print a hard copy of the next day's appointments before leaving each evening so that mornings go more smoothly. And some offices keep an appointment book as a backup to the computer system. Appointments. There are many styles of appointment books, some color-coded. Multiple columns may be available to correspond with number of doctors in a group practice. Again, I don't think that's something that you're going to come across very often in facilities because almost everyone uses computerized appointment making. So let's talk about self-scheduling. This comes from patient portals, and it allows patients to use the internet to view a facility's schedule and select his or her own appointment time. It reduces call volumes to the office, and it's available to the patient 24/7. Can also send email reminders the day before an appointment to request confirmation. Phoned-in appointments must still be offered. So you can't require a patient to set their own schedule. But in this tech-savvy world now, more tech-savvy patients can do that, and it may just be a very convenient thing for them to do. So the system will protect confidentiality by only showing available times, not patient names. So if a patient wants to self-schedule, you don't have to worry about them being able to see who else is coming into the facility. These systems reduce wait time for patients who do not care to wait on hold. So let's talk about the legality of appointment scheduling systems. Appointment systems must be accurate because it can be used as a legal record. When you have missed appointments, it should be noted in the medical record. In an appointment book, pencil is used so that changes can easily be made. You should always include the patient's name and their phone number. An appointment book should be kept for state statute of limitation and then shredded when discarded for privacy reasons. So, types of appointment scheduling. Different types of appointment scheduling to meet the needs of the facility, providers, and patients should be considered. Some offices combine methods to make the right mix of activity during the day and to ensure the day runs smoothly. It must be proficient at managing appointments. So not only does the software or the type of scheduling need to be proficient, I'm sorry guys, I'm getting so tongue-tied, needs to be proficient at managing appointments, but you as the appointment maker should be proficient. Okay, so this is a time-specific stream scheduling. This type of scheduling schedules appointments that allows practitioners to see more patients with less pressure. It requires a person who is good at multitasking and being efficient, and you must be able to think critically, and it's critical to understand how long each procedure requires and time for pre-visit paperwork. So another type of scheduling is wave scheduling. This attempts to create short-term flexibility within each hour. It assumes time needed for all patients seen will average out over the day, and rather than scheduling at intervals, several patients will be at the office at once and seen in order of arrival. Then you have modified wave scheduling. Here's an example. Have two patients come in at 10 and one at 10:30, repeating the cycle throughout the day. Another example, patients are scheduled to arrive at given intervals during the first half hour, then none is scheduled during the second half hour. So now we have double booking. Double booking is booking two patients at once to see the same provider and is poor practice. Now here's an exception. One patient will only take 5 minutes. Double booking should be avoided or reflected in the schedule. It is not considered double booking if a patient comes to the office to receive a treatment by someone other than the provider, such as a patient receiving physical therapy or an anti-allergy injection. So, open office hours. This is when the facility is open at given hours when patients are told to return in a couple of weeks for a follow-up. Patients can come in at intermittent times, seen in order of arrival. It eliminates broken appointments and prevents them from running behind schedule. It's most commonly used at labs, imaging facilities, urgent care facilities, and emergency departments. Here are some disadvantages: crowding and long waits, ways of busy times and ways of slow times, and it's potentially overburdening to the staff. Grouping procedures. Grouping or categorizing procedures is another way to approach scheduling. Medical offices may often try several ways of grouping before finding the best way. Medical assistant may find it helpful to color code sections for grouped appointments. For an example, an internist might reserve all morning appointments for complete physical examinations, or a pediatrician might keep that time for well baby visits. So let's talk about telephone scheduling. Be pleasant and helpful when scheduling over the phone. It helps to smile because they can always hear your smile. Try to accommodate a patient's requested appointment time if possible. If not, be considerate, offering alternative times and dates. You could say, "Oh, I'm sorry, we don't have that time available, but would you be able to take 2 o'clock on the 5th or 3 o'clock on the 6th? It feels like they have choices. Offering two choices for a time slot is encouraged so that the patient feels he or she is in control of his or her time. You should always repeat the time and date of the appointment at the end of the call and ask if the patient has pen or paper to write it down. Check the appointment book or computer screen to be sure it is entered correctly. You should write legibly in appointment book and obtain a daytime phone number for each patient, so that when you're looking at the paper book, you already have the information you need to call the patient back. Having patient cell numbers makes it easy to contact them quickly. Scheduling appointments for new patients. So what is a new patient? Well, a new patient is a patient who hasn't been seen in this facility by any of the doctors in that specialty in the past 3 years. New patient scheduling requires time and attention to detail. Tact, courtesy, and professionalism are very important, and request preliminary information so that you know how much time to allot. Offer the patient the first available appointment, giving a choice between 2 dates and times. Offer directions or physical address to the office. Provide parking information if it's needed. And options for first payment should be discussed. Repeat appointment date and time and thank the patient for calling. You should expect the patient to have concerns about the amount of the first bill and should be sure to address this issue before the appointment to avoid misunderstandings. Some medical offices mail or email an information packet to new patients. If the patient is a referral, you may need to call referring provider's office for additional information before the appointment. Print and give the referral information to the attending provider before the patient arrives, and send a thank you note to anyone who refers a patient to the medical office. So, scheduling appointments for established patients. This is in person. So let's define established patient. This is a patient who has been seen in the facility or the specialty within the 3-year allotted period. Most return appointments are arranged when patient is leaving the office. Have all patients stop by the front desk before leaving in case information is needed or outside scheduling must be done. Ordered tests or procedures can be discussed and scheduled. Offer patient 2 choices for time and date. Scheduling appointments for established patients by telephone. To find a suitable time in the schedule, you only need to know when the patient must return. No need for directions or parking information, and recheck information with patient if it has been a while since the last visit. What sort of information should be rechecked with established patients? This is very, very important. The address, the phone numbers, insurance company or benefits, and the email address. Scheduling other types of appointments. So here are some examples of other types of appointments to schedule. Inpatient surgeries, outpatient and inpatient procedure appointments, outside visits, providers, pharmaceutical representative, and salespeople. So let's talk about inpatient surgeries. When scheduling surgery, the surgery call facility where the procedure will take place as soon as it is planned. Provide all necessary information and state any special requests provider may have, and you may need to provide insurance information and certainly phone numbers. Most surgical departments and centers have a surgical secretary who makes these arrangements. Outpatient and inpatient procedure appointments. Arrange laboratory or radiography appointments for patients. Have all necessary information handy before calling the facility to schedule. Relay the time and place for appointment and special instructions, also noted in the medical record, to the patient. MRI or CT scans, X-ray evaluation, ultrasonography, and simple blood tests. Provide patients with name, addresses, and phone numbers of the facilities where tests are being done. Some patients require a series of appointments. Try to set up these appointments at the same time or day of the week to reduce the risk of patients forgetting. May be responsible for scheduling inpatient admissions or inpatient surgical procedures. Scheduling inpatient admissions or surgical procedures is similar to outpatient testing, but the medical assistant coordinates with the hospital instead of outpatient testing facility. Remember when we talked about coordination of care? This can be part of coordinating care. Let's talk about late patients. For habitual late patients, you should schedule them the last for the day And this means if they arrive after closing time, there is no obligation to wait. Some tell habitually late patients to arrive 30 minutes before the patient's appointment time. Make an attempt to work with patients who have occasionally difficulties arriving on time. Do not let the schedule be disrupted by consistently late patients. Rescheduling appointment. Unexpected conflicts call patients to reschedule. Remember to remove first appointment day and time from the schedule and then set new appointments. Emergencies. Emergencies are one of the many reasons it is helpful to have some blocked time out in the schedule for unexpected visits. Patients who are actually ill should be seen the same day. The urgency of calls determined by a list of questions prepared for reference. The patient may need to be directly referred to the hospital emergency room department, and never place emergency call on hold and stay online until EMTs or other help arrives. Obtain the name, the phone number, and the location at the start of the call. Patients without appointments. Providers must agree to a policy for patients with no appointments, and the medical assistants must follow through. There will be policies for everything we're talking about when you get into the facility. We're just giving generalized information. Patients requiring immediate attention should be accommodated somehow. If immediate care is not needed, a brief visit with the provider or scheduled appointment for later on can solve the problem. So, why do patients fail to keep appointments? Forgetfulness, owing money, and denial about their condition. So we're going to watch a little short video on how we can reduce missed health appointments.
The news headlines tell us that when we don't attend a health appointment we've booked and don't cancel to make it free for someone else, this can cause problems. These problems could be not only for ourselves and others, but also for our already squeezed NHS services. So why do people not get to their appointment? There are lots of reasons. They might get stuck in traffic, or even be nervous of bad news. Surveys show that often people simply forget. So what can be done about this? Some studies have shown that text or phone reminders can help a little. Some health centres have taken a more drastic approach. Patients are told that they might be fined or even discharged if they miss an appointment. This can be seen as uncaring by patients and may end up with people becoming more unwell, increasing the need for urgent care services. In many clinics and surgeries, notices are put up in waiting rooms pointing out the number of missed appointments to try to make patients take this more seriously. These don't always work and can be off-putting. Recent behavioural psychology research has suggested two strategies which might work better without risking negative effects. These are social norms and active commitments.
Oh, sorry, guys.
Firstly, the idea of social norms is that people tend to follow what they think most people do. Notices which show that most patients in the surgery keep their appointments or cancel in good time highlight the social norm of people doing the right thing. This is a very different way of phrasing the facts. Secondly, the more actively involved we are in making a commitment, the more likely we are to keep it. Active commitments involve staff inviting patients to write down or repeat back their appointment when they book it. Two studies have trained staff to try these out in GP surgeries in the UK, and both found that they had a big impact, reducing missed appointments by up to 33% a month compared to previous months. One shorter-term study in 2012 suggested it was definitely the strategies that helped, since when the old ones were swapped back in for a month, missed appointments went back up. Our own study in 2017 focused on the longer-term effectiveness and found that the strategies need to be used by staff consistently over time to keep up the benefits. Overall then, two small, easy-to-use and positive strategies from psychology seem to have a big impact on the problem of missed appointments. What if this could be scaled up? We think this has exciting potential for other areas of healthcare. If you like this video and think it might help ease the squeeze in your health service, why not like it and share it to help spread the word? Our study was a collaboration between a patient.
Okay, so that gave you the general information with some ideas about helping patients keep their appointment. When the patient cancels, keep a list of patients with advanced appointments who would come in sooner if the appointment opens up due to cancellations. A lot of time, sorry, sorry guys. If I go to a specialist and it's a long time out, I'll ask them to let me know if they have a cancellation so I can come in earlier. Note each cancellation in the patient's medical record with reasons if that's possible. When the provider is delayed, call patients and suggest they come later if advance notice of the delay is known. If patients have arrived, let them know of the delay and explain it is an emergency. If the delays happen often, consider a different scheduling system. Emergencies. When the provider is called to an emergency. Providers frequently have emergencies, and most patients are understanding. Tell patients they can wait or reschedule for another day. Quickly call patients scheduled for later if the schedule is affected to cancel before their arrival. Okay, so now we're going to talk about patient processing tasks. When the office staff is committed to making the patient feel welcome and the focus is on care of the patient, success of the practice is inevitable. When patients have a good experience, they are likely to tell others. It's word of mouth. The most common visitors to the facility will be patients and family members who have appointments. Patients need to be greeted as quickly as possible, and they need to know where to go and what to do. If too much time elapses between the person's entrance and the greeting, the person may feel ignored or unimportant. Glass windows should be kept open as much as possible to give the appearances as openness to others. Now, we do know that since we have COVID, things have changed quite a bit. But before COVID, this is what we were doing. The patient's arrival. There needs to be a sign-in register, but it needs to be HIPAA appropriate. Infection control in the reception area. You need to ask a few screening questions. Well, I know now when we go to our pediatrician, we have a sick waiting room and we have a well waiting room. So that really does help in the screening. Registration for new patients. Demographic and health history information. Guys, this is something you've got to know. This is what you need on that information. The patient's full name and date of birth, responsible person's name in relationship to the patient, address and telephone number, name, address, and telephone number of contact person, occupation, place of employment, and social security number. Check-in procedures for all patients. You may have to perform the verification of eligibility, which is their insurance information. Scan or copy both sides of the patient's insurance card. Many healthcare facilities are also scanning or copying patients' legal photo identification, and some facilities insist that copays be collected before the office visit. Patients with special needs. Some patients are physically challenged, some are very ill, and some are uncomfortable. And language cultural barriers may exist. Showing consideration for the patient's time. There should be signage in the reception area stating that the patient should let the receptionist know if they have been waiting for longer than 15 to 20 minutes. If the provider is delayed, the medical assistant should let the patients know. And some facilities will offer patient gift cards if an error occurred in scheduling or if the patient needs to reschedule due to long wait time. Listen, I've never been offered a gift card, but hey, that would be great if they did. So now we're going to watch a video about chatty callers. Some of you have seen this, some of you have not, but we're going to watch it again. Okay, it's taking its sweet time, guys, but I have it loaded.
What do you do with a talkative caller? Hang up and pretend it was an accident?
And the coffee's so good because they have some kind of frothy thing on there that's fabulous. And we
Pretend to listen and do something else
And it was
instead.
very inexpensive, except when you got to the really big cities where it was much more expensive. But then I guess you come to expect that in big cities. And the weather was wonderful, except about
Talk over them and beat them at their own game?
Yes, that's great, Mrs. Burke. Okay, gotta go. Bye-bye.
Because they
Or just go with the flow?
That sounds fascinating. Yeah, I wish I could have been there. Uh-huh. Oh, really? Uh-huh. Well, I've never had a schnitzel.
This is where you must balance polite and professional. Begin by using the caller's name to get their attention.
Mrs. Burke? Mrs. Burke?
This will give you the opening you need.
I certainly enjoyed talking with you today, but I'm afraid I need to go now so that I can help these other patients. We'll see you on the 17th at 9 a.m. Thank you so much for calling Dr. Waite's office. Have a great day. Goodbye.
Balance polite and professional to close the conversation. This educational tool is designed to help you and the members of your practice with all aspects of telephone training. From the main menu, simply choose the areas that are most important to you and your office team members. We've also included printable In-A-Wing Think books.
Sorry about that. It's a little hard to get it to go back to the regular size after you push play and it goes big. Okay, so children. Let's talk about children. Usually parent or guardian accompanies a child into the examination room, but there are exceptions. Parents are responsible for their children's behavior while at the provider's office, and the medical assistant should not discipline the child. Let's talk about angry patients in the reception area. If possible, invite the patient into a room out of the reception area. Present a calm attitude, speak in a low tone of voice, and there should be a policy in place for dealing with potentially dangerous individuals. So patient checkout. Greet the patient with a friendly smile and again call the individual by name. Check the health record to see if the provider wants the patient to return and make any return appointments. Legal and ethical issues. So appointment schedules can be subpoenaed to court as a legal record. Be sure all handwriting is legible, and the information collected is consistent. Note all no-shows in appointment book and medical records. Keep an old appointment schedule Okay, I'm going to be able to get this out, guys. You should keep the oldest appointment book that meets the statute of limitations for your state. There we go, I got it. Okay, that is the end of our slideshow. Okay, I know there was a lot of information and probably some of you already know. But we're just reiterating and we're just going over to refresh your memory I think the most important thing when you're making an appointment or when you're answering the phones, there are several things that I think are very important. Number one, professionalism and kindness, and not making the patient feel like they're bothering you. You need to understand that it's just like customer service because the patient is your customer. The second thing is organization and accuracy. Make notes. I keep a pad and paper even at school when I'm sitting at my desk. And if I get a phone call on my cell phone, no, it's not from a patient, it may be from a student, but I always try to make a note on my pad so that I don't forget. Keeping a tidy workstation, keeping it organized, and keeping great notes are wonderful tools in making sure that the facility runs smoothly. All right, so I hope that you guys enjoyed our lecture. I'm sorry that I was tongue-tied. I have some sinus going on, and so it's difficult. I feel like I have a sore throat. It's just allergies and change of weather. If you guys have any question or you need anything, you know I'm always available to you. Just let me know. All right, guys, have a great evening, and I'll talk to you later. Bye-bye.